What's new for dictation in general practice? In this episode, I'm going to showcase to you what you can do with Lexacom Echo, one of the really effective providers of dictation tools for general practice, and how it might save you time and a lot of stress with some of their new features. Let's tech enhance your primary care and learning. Now, Lexacom have been a provider of dictation tools for many years, and their newer tool, Echo, has been around recently and undergone some interesting changes, and the team from Lexacom have given me a demo version to try and use to see how these tools can help you in your practice. Now, just to recap, Lexacom is one of those tools that's a point-and-click dictation tool, so wherever the cursor is, it will dictate from there. You can do a little bit of navigation, like next paragraph, please, and it will move around from there. It is cloud-based, so when you talk, there's a tiny pause and then it spews out all that lovely prose and text that you've been talking about. And it has many of the other standard features that you'll see in cloud-based dictation tools, like things like macros and potentially some really cool stuff coming, which the team are working on. Things like dictation translations and stuff. It is a nice, simple tool to use. Once it's installed on your PC, you can use any microphone. I use the webcam on my PC, so you don't need a separate microphone at all. Although, obviously, using a headset may give you better quality sound pickup. And that is irrespective of whether you're wearing a mask or not, because I've been doing both over the trial period that I've had. It is pretty accurate. I'm not going to deny there have been a couple of times where I thought it could have picked up words slightly better. That could be, let's be honest, the way that I talk. I'm a bit of a quick talker normally. If it does make a mistake, there is a feedback tool. I do wish it was slightly easier to use. It'd be nice if it was just a point and click and rephrase from there. The interface is a little bit clunky, but that's clearly something that could be changed. However, it does have one really cool feature that I know that they've been developing for the past few weeks, and you may find really useful to use in practice. Patients now have access to their medical records, and simplifying the information that they read is a really important thing. So you can use one of the 3 different modes in Lexacom to help you do that. There is the normal mode, which is exactly what it sounds like. There is the doctor mode. That's right, you can use doctorese, or is that called jargon? And it will document exactly in the things that you want, such as coded language, readings, ERTs, etc. Or you can switch it to the patient mode. And when you talk in this mode, it will enhance and expand the information you put in to make it easier for the patient to understand. So, for example, if you say renal, it will then put in brackets after that kidney. If you say lymphadenopathy, then it will say enlargement of the lymph nodes, or bigger lymph nodes, depending on what you set it to. Now, I wish I could show you this in action. Unfortunately, my computers at work don't allow me to screen record and use the microphones at the same time. Can't cope with multiple microphones. But trust me, it does work. It's really easy to switch on and off. You can either use the buttons or you can use the keyboard shortcut insert to help you do that. And yes, they like their keyboard shortcuts, which I absolutely love. So if you want to give Lexacom Echo a try, have a look at this link right here. That'll take you straight to their sign up page right here, and you can have a look at whether this tool will work for you in your practice. And if you want a deeper dive into what Lexacom Echo can do for you in your practice, let me know in the comments down below. More than happy to cover that for you. Alternatively, if you're looking for a non-dictation based tool to help you in general practice, check out this episode right here as we continue to tech enhance your primary care and learning.